Dr. Ezine. I'm an optometrist and working with Brightstar-Care Specialist Hospital, Imo State. Okay, so we started a free medical outreach since 1st of April. That will be ending on the 14th of April. And what prompted this outreach is because of the interest the owner of this hospital has in reaching out to the community, to people outside, people who can't access free healthcare. You know what is happening in the country now. Healthcare is quite expensive, so she brought it down to the local community so that everybody could have a standard healthcare examinations, and they are able to, some of them are being able to access, being diagnosed, and being taken care of. Some cases that are manageable, we manage, and some that can be treated are being treated, like cured completely. Now, since the outreach, we've been having a whole number of glaucoma patients, and the shocking part is that majority of them don't know they have glaucoma. Glaucoma is, we call it the silent thief of the eyes. It ravages, it affects the optic nerve. It is a group of diseases that affects the optic nerve, and optic nerve is the nerve fiber that connects the eye to the brain and pass information. Just like the eye is just like a camera, it captures the image and then it goes straight to the brain. The brain interprets it as the image that you're seeing, and that is the function of the optic nerve, and that is the target of this glaucoma. And one major problem patients are having is because the one that people overhead are suffering are asymptomatic. It doesn't give any symptoms. You see an individual who feels he's seeing properly, normal, going around his or her activities, and at the end of the day, you see them coming down with blindness and dimmed vision. Now, for example, on the 1st of April, we saw a patient, a man of 45 years old, who said he was driving down the street of our hospital and noticed that he kept having encounter with buses, bike people by the side, his left side of his car. They kept hitting him, so he drove in and he saw our signage and walked into the hospital. So on assessment, we found out that he is no longer seeing with his left side of the eye totally, after all the investigations we did, and lo and behold, he had glaucoma. And he said he has been observing that the visions are dimming. He has been having this smoky vision and all of that, which the onset is early in the morning and it goes off during the day. He feels he sees better during the day, and he didn't see it as anything until that fateful day. So the free medical is helping people. Even the ones we saw today, there is one that has NLP in one eye, and he did not know that he has no light perception in one eye, but the other eye is seeing perfectly well. So this is likely cases of glaucoma. You see people coming down with it, they don't know they have it. There are signs and the symptoms are not obviously there. Someone who is not meticulous will not know about it. The test I just concluded now is called intraocular pressure test, and this is a tonometer. It's used to check the intraocular pressure, and this intraocular pressure, when it's high, it also affects the optic nerve. Now it needs to be regulated, so that's why when they come, we subject them on several tests of glaucoma. They also have the visual field test to know the extent they are seeing, the entire visual field is seeing, to know if there are some nerve fibers that are dead, and the drugs we should place them on. So basically, it's been going on well in Brightstar-Care Specialist Hospital, and I want to also appreciate our CEO who has funded this. We are giving free medications, and all these tests are done free of charge. So I really want to appreciate her, because people are really benefiting from it, and we're urging our patients out there to come around, check your eyes. At least we advise people who are hypertensive or diabetic to check their eyes at